Imagine discovering you have a serious illness like heart disease or even dementia years before any symptoms appear. Sounds like science fiction, right? But what if a simple eye exam could provide that early warning? Specialists are increasingly recognizing the retina, that light-sensitive layer at the back of your eye, as a surprisingly accurate predictor of major health problems. It's not just about seeing clearly anymore. It's about seeing into your future health. Dr. Kasu Prasad Reddy, founder of Maxivision Super Specialty Eye Hospital, puts it this way. A retinal scan is like a unique window into the body's internal health. He highlights a crucial point. It is the only place in the body where microvascular and neural tissues can be directly observed without any invasive procedure. Think of it, doctors can examine tiny blood vessels and nerve cells directly, without any needles or surgery. So, how exactly does the retina act as an early alert system? The retina, with its intricate network of tiny blood vessels and nerve cells, is incredibly sensitive to subtle changes within the body. These changes can signal the presence of disease long before they become obvious in other organs. As Dr. Reddy emphasizes, these subtle shifts, often invisible to the patient, can provide early warnings, giving you a head start in managing your health. Large-scale studies, including research from the UK Biobank and Harvard Medical School, have found compelling evidence. These studies suggest that even tiny alterations in retinal blood vessels, such as slight narrowing or the appearance of microaneurysms, tiny bulges, can predict the risk of stroke, heart disease, diabetes, and even dementia a staggering 5 to 10 years before traditional symptoms manifest. That's valuable time to make lifestyle changes or begin treatment. And this is the part most people miss. The advancements in technology are making these early detections even easier. Newer tools like OCT, optical coherence tomography, which provides a detailed 3D scan of the retina, wide-field imaging, capturing a much broader view of the eye, and AI-based analysis are revolutionizing the field. These technologies allow doctors to detect subtle risk signs at a very early stage, often before any symptoms are noticeable. It's like having a super-powered microscope for your eyes. What can your eye's blood vessels reveal about your heart health and blood pressure? Think of the blood vessels in your eyes as a mirror reflecting the overall health of your circulatory system. Dr. Reddy explains that when these tiny vessels become unusually narrow, widened, or show abnormal crossing patterns, it can indicate rising blood pressure or strain on the heart and blood vessels elsewhere in the body. Furthermore, the appearance of cotton wool spots, fluffy whitish patches on the retina, small bleeds or those tiny balloon-like bulges, microaneurysms, can signal reduced blood flow and vessel damage, even in individuals who feel perfectly healthy. This makes routine retinal exams an invaluable screening tool for silent hypertension, coronary artery disease, and stroke risk. It's a non-invasive way to get a sneak peek at your cardiovascular health. How is the retina linked to cognitive decline and neurological disorders? Here's where it gets controversial. Because the retina is directly connected to the brain via the optic nerve, any changes in its structure or function can serve as an early warning sign of neurological issues. OCT scans, for example, can detect thinning of the retinal nerve fiber layer or loss of key nerve cells, both of which are associated with an increased risk of future cognitive impairment and dementia. Some researchers even believe that changes in the retina could potentially differentiate between different types of dementia, like Alzheimer's versus vascular dementia, but more research is needed in this area. Other signs, such as a pale appearance of the optic nerve, indicating nerve damage, reduced blood flow, or microstructural abnormalities, may point to multiple sclerosis. Even fleeting episodes of blurred or dimmed vision, or small areas of the retina briefly losing blood supply, can sometimes precede a stroke. The eye, in essence, can act as a window into the brain's health. Diabetes, thyroid issues, and your eyes. What's the connection? Hormonal shifts have a significant impact on the delicate blood vessels and nerve energy usage in the retina. Diabetes, for example, weakens these tiny vessels and causes oxidative stress, which leads to leakage, swelling, and early retinal damage long before other diabetic complications arise, explains Dr. Reddy. Autoimmune thyroid diseases such as Graves' disease can cause inflamed tissues around the eye, leading to eyelid retraction or increased pressure on the optic nerve. Conditions like POS or prolonged cortisol elevation may destabilize the tear film and trigger surface inflammation. Recognizing these patterns allows for timely systemic testing and preventive treatment, potentially mitigating the long-term effects of these conditions. When eye inflammation signals immune trouble, autoimmune diseases can sometimes manifest in the eyes before they appear anywhere else in the body. In conditions like lupus, rheumatoid arthritis, or inflammatory bowel disease, the blood vessels in the retina may become inflamed, or patients may develop recurrent non-infectious uveitis, inflammation inside the eye, even before experiencing other symptoms. Certain infections, including tuberculosis and syphilis, can also produce distinctive retinal inflammation, offering crucial diagnostic clues. Why routine retinal imaging matters. The bottom line: early detection is the cornerstone of preventive care. As Dr. Reddy emphasizes, the retina has become a crucial biomarker in modern medicine. New technologies have ensured that the retina can be used as a sensitive and non-invasive measure of early detection of underlying risks. Regular eye exams, therefore, are not just about vision correction. They're about safeguarding your overall health. But here's where it gets controversial. How often should you get these specialized retinal scans? While annual eye exams are generally recommended, the frequency of more advanced imaging may depend on your individual risk factors, family history, and your doctor's recommendations. Some argue that widespread routine screening with advanced imaging could lead to overdiagnosis and unnecessary anxiety, while others believe it's a crucial tool for proactive healthcare. What do you think? Should these advanced retinal scans be a regular part of preventative health, or are they best reserved for those at higher risk? Share your thoughts in the comments below. Disclaimer: this report is for informational purposes only and does not constitute medical advice. Always consult with a qualified healthcare professional for any health concerns or before making any decisions related to your health or treatment.